just been joined by Professor Niv Patil from Hong Kong, and it's great to have you here, Niv. You're a long-standing supporter and member of AMEE. But this year something new is happening. I see there's a track for the practice of surgery and the education of surgeons. What's the background to that?
Sure, it's okay. Thank you, John, for having me. And as you mentioned, we had a long association with Association for Medical Education in Europe, which is truly an international organization. And this year's theme about surgical track, which is taken upon with the support from AO, is very important for one reason. Even at undergraduates and postgraduates and medical educators, I always talk about surgery is a high-stake discipline. People's expectation from the surgeons and in terms of outcomes are very high. At the same time, it's a high-stake discipline, as I mentioned. And it's not just about the technical expertise. There are many other issues related to surgery, particularly informed consent, cost effectiveness, and related to patient safety. Okay. And so with all these three important things about patient safety, informed consent, and the cost effectiveness, I think it's very important that AMEE has taken surgical track as a theme, parallel theme of course, in this meeting, spreading over all 4 days of the meetings. Okay. And I think I'm delighted that this has happened. There are delegates, speakers, panelists involved in this particular surgical track, and they will be covering many aspects of not just learning about the technique. Of course, there's a thing about simulation. Okay. Now, there's a lot of discussion about simulation, and people sometimes use simulation as a status symbol. But in fact, in this conference, I think there's issue about simulation, how effectively we can make use of it, and along with other things like competency-based surgical education. So that's in short that I'm really pleased that surgical track has given a due importance in Association for Medical Education.
And that's wonderful, and I know you've been instrumental in bringing that about with your relationship with AMEE as well as a surgeon in your own right. A lot of the material in the surgical track, of course, is pertaining to surgery and surgeons, but there's a lot in the rest of the conference, isn't there, which is relevant now to contemporary practice.
Yeah, correct. I think the AMEE, as I look at the program, is like A to Z of medical education. Okay. Just like your book on practical teachers. Okay. It's A to Z about it. You look at the program, it's not just the curriculum. There are things about assessment, evaluation, internationalization, communication, language issues. You name it and it's there. And I think it really makes a medical education conference not just one theme based, it is really comprehensive, which we need. We know that there are about 3,000 plus medical schools around the world, and they are all parts of the world. And it is important that there is some kind of understanding we have across the board, nationally, internationally, about the basic skills in medical education.
And that's very good. And as you know, we're in AMEE teaching Essential Skills in Medical Education course for the 12-week package for members of staff in different places who are involved in teaching, and that's very, very worthwhile. We hope that the surgical team will feel part of the AMEE conference. Do you think that's likely?
I'm pretty sure that. Now, I know there's always criticism of the surgeons are not actively involved in activity related to medical education curriculum planning. But now I think the scenario is changing. Okay, even at the universities or medical schools and the postgraduate colleges. Okay, I mean, just to give an example, College of Surgeons in Hong Kong or Edinburgh or anywhere else, people have taken surgical education as a theme in those colleges. Now, it is true that they have to get more involved in undergraduate education, okay, but that is happening now. I think I could see that many of the directors related to medical education, like myself and yourself, are involved in global issues related to medical education, not just the surgical education.
And I think that's a good point. Elsewhere, I've been talking to a specialist in global health who's been able to come to the conference and look and see how big the conference is. 3,500 people this time from 102 countries.
Sure.
So the impact of health, the impact of this conference is very big. What take-home messages do you think you'll have personally this time?
I think we just started now, but just looking at the program, I think people has to think about, means I always think about undergraduate medical education, for that matter even postgraduate medical education. It's not, when we say fit for purpose, it's not fit to pass exams, it's a fit to practice.
Good.
And I think this particular international conference or AMEE is really looking at those issues, even like Aspire, medals and things, or recognition. And that is really about fitness to practice issue, not just fit to pass exams.
And that just reminds me of your foundation, the Patil Foundation has generously supported the program here with prizes in different categories for presenters and in posters.
I thank you so much, Bob, because
thank you
this
very
is
much.
my father's, not mine. But it is important that we need to have support for medical education, excellence in medical education. And I'm glad that my father was part of that.
Thank you very much for joining me this afternoon.
Okay.
It's been a
Thank
pleasure.
you for having me.
Professor Niv Patil, thank you.